covering news in your town. You're watching CBS3 Springfield News at 4.
If you have migraines or know someone who does, you know the intense pain can last for hours, sometimes days. But doctors say facial surgery may work to relieve those migraines for some people. In today's House Calls, Dr. Fadi Nukta, a plastic and hand surgeon at UMass Memorial Medical Center, joins us live via Skype.
Having me.
Hi, doctor. Thank you for joining us today.
Thank you. Thanks for having me.
Well, how does migraine surgery work?
Migraine surgery is based on findings that in some patients, certain nerves in the head and neck can be pinched by muscles they run through. And over time, with this constant pressure, it causes the nerve to become irritated, and it triggers a cascade of events that eventually leads to a migraine attack. So the idea of migraine surgery is to be able to identify those nerves in order to release the muscle compressing them, in order to improve the symptoms of migraines.
So what is the role of Botox in this kind of surgery?
So the process is multiple steps. The first step is for the patient to tell us what part of the head hurts the most, or where do the migraines start. We inject those areas with Botox, which, as you know, is a toxin that temporarily paralyzes muscles, and it calms the nerve endings. If the patient responds to the Botox, then we know that with certainty, or in about 90% certainty, that they will respond permanently if we remove that muscle. So we don't really use the Botox to treat the migraines, but we use that to determine whether surgery will help the patient in the long term.
So who is a candidate for this type of surgery?
The surgery is definitely not for all migraine patients. It's reserved for people who have been seen by a neurologist for a long period of time, has tried all the conventional medical treatments, but we're still getting a significant amount of migraines. In our center, we define significant amount by 2 migraines at least a week. Those patients will actually see a benefit by doing the surgery. It's very important. The patient selection in this operation is extremely important, as results show that 90% success rate if the patient is selected appropriately.
2 migraines a week is very significant. That seems like it's a debilitating problem for many.
It is, and until I started working with this, I never knew that people can have so many migraines. I thought migraine is something you get once a month or a couple of times a month, and that's what happens in a lot of patients. However, one of the first patients I performed surgery on, she was having migraines 20 days out of the month, and now she's down to no migraines at all.
Well, that would be hard to function, really.
It's almost impossible to function. A lot of these patients complain about how many family functions they miss, how many days of work that they have to miss, the weekend that they spent in a dark room, and they kind of just wait for the migraine, helplessly waiting for the migraine to end.
So when they do have the surgery, what's the best case scenario?
Oh, the best case scenario is for the patient to be cured. This occurs in about 30% of patients. So most studies showed that 85 to 90% of patients will have a significant improvement in their symptoms. And we define significant improvement as a 50% reduction in the intensity, frequency, and the duration of attacks. So if a patient comes to us and they get, let's say, 10 migraines every month, and the intensity, let's say, is 8 out of 10 in terms of how severe the pain is, we expect them to have at least or not more than 5 migraines a month after surgery, and with the intensity to go from 8 out of 10 to 4 or 3 out of 10. So a lot of patients complain, they say that even the migraines that they get now are much different than the migraines they got before. Now that they can treat it with a Tylenol versus before they just had to wait for the migraine to end. So 85 to 90% of patients will have this kind of improvement. Of those, there's about 30 to 40% that will be cured of migraines. So we don't usually tell patients they're going to be cured of migraines, but at least you're going to have a significant improvement.
Okay. Well, thank you, doctor, for joining us.
Thank you very much.
Now, if you have a medical question you would like answered during House Calls, email me at housecalls@cbs3springfieldnews.com.